Hi everyone, welcome back to my channel. If you're new here, I'm Zacovia and I wear many hats, many titles. Some of those include wife, mom, real estate agent, registered nurse. However, the one that's significant as to why you're watching this video right now and listening to my voice is that I am a breast cancer survivor. And so today I wanted to take on the challenge of identifying some signs of breast cancer that I think that we need to pay more attention to, just so that we can be more proactive in our health and being a better advocate for ourselves. I feel like these are signs that you definitely don't want to ignore because it can definitely help save your life, basically. All right, so let's dive in. So, we all know, or at least we should know, especially if you watched my previous video, that one of the biggest misconceptions about cancer in general is that it only affects older adults. Well, this misconception holds true when it comes to breast cancer as well. In fact, breast cancer is the most common type of cancer for women under the age of 40. And so knowing that makes you wonder, why are we failing to identify signs and symptoms early on? I believe that one of the reasons we may not be paying attention to this is not only because we have a disbelief that it only affects older adults. I feel like our healthcare providers may somewhat have this disbelief as well. I don't think anyone is really paying attention to how the numbers are rising, especially for women under the age of 40. So I've identified 4 signs that I want you to definitely pay attention to. And these are the signs that I definitely don't want you to ignore if you see these. Honestly, this is for anyone of any age, but especially for women under the age of 40, because again, this is something that we're seeing where women under the age of 40 are being diagnosed at higher rates. And so I want you to be aware of this because you're under the age of the recommendation for mammograms. And so if we are only paying attention to our breast once we get 40, then unfortunately for some people that's too late. And so for those who are under that age, you want to pay attention sooner. One of the signs that I want you to pay attention to is discharge. Now, this age group is kind of tricky because women under the age of 40 are also childbearing age. So, with that being said, discharge for a woman that's childbearing age may not seem like it's a big deal. However, it is a big deal if you're not lactating. So, if you haven't just delivered a baby, you're not breastfeeding a baby, and you have discharge, I don't care if it's looking like milk, I don't care if it looks like blood, I don't care if it's just white, clear, I don't care what it looks like. If you have discharge and you're not currently lactating, that is abnormal. And so you need to get seen. Don't just ignore it. Don't just think, well, maybe this is, some new symptom because I'm now this age and, this is part of this change. No, you should not have discharge from your breast if you're not lactating. When you're lactating, that's normal to have breast milk come down. But when you're not lactating, it's not normal to just have leakage and drainage coming from your breast. Now, with that being said, if you do have drainage, if you do have discharge, it doesn't automatically mean that that's breast cancer. However, it is something that you want to have examined. You want to know why. Again, if you're not breastfeeding, then why do you have discharge coming from your breast? And so, schedule an appointment right away. If your healthcare provider seems like they're brushing it off and they don't think it's a big deal, then maybe you need to see a different healthcare provider, because what you want to get at that point is you want to have someone that will at least take you serious and, maybe not have the answer themselves at that time, but they're willing to refer you to get additional testing. And so at least you should go get a ultrasound done. And then maybe they'll want to do a mammogram or a breast MRI. Regardless, you want to have additional testing done to see why this may be happening. Because again, it may not necessarily be breast cancer, but why is it doing that? And so if that's happening to you, you want to know why. That should be, the biggest, you should be seeking that answer to that question. And so whatever it takes to get that answer, you want to proceed in that direction, you want to proceed in those steps and do whatever is necessary to get those answers that you need, because you need to know why. My next sign basically will piggyback off of the nipple discharge. Another sign, again, kind of is, I hate to keep using the word sudden, but for lack of better words right now, if you have a sudden change in your nipple appearance, that is a reason for you to call your provider. That is a reason for you to have an exam done and possibly additional testing. This is what I'm meaning. If you are known to have, let's say it's cold outside and people are like, oh my gosh, your headlights are on. If your nipples are protruding most times, and then you notice, one day where it looks like one is retracting, it's hiding back within the breast tissue, it's trying to, cover itself and hide completely away, that's abnormal. You need to be seen. Doesn't necessarily mean that it's breast cancer, but that is a sign for breast cancer for some people. And so, with that being said, if you notice a change like that, then you need to be seen, okay? My next sign, if you see any change in the overall breast, you need to be seen, okay? So what I'm saying is basically a sign that some women pick up on is that it appears as if the breast has like dimpling, or it appears as if it has like huge, big open pores. Like you can literally look at your skin and it looks like your pores are very large and very open. These are changes that you want to have examined, because you don't know what may be going on internally that may be causing that, especially if this is not something you've had your whole life. If you weren't born that way, if that wasn't part of your normal developmental change when you went through adolescence. And so that's something you want to have looked at. Sometimes it will even resemble like a orange. This is the change I'm trying to get to. Any change in your skin that makes your breast kind of look like an orange because of, like I said, you can see like how big the pores are. You want to be seen by a doctor. And I'm going to always kind of come back to the fact that if you are seen by your doctor, you are under the age of 40, and they're thinking like, well, you're too young, it's probably not breast cancer. You need to push to get additional testing, get an ultrasound done, have a mammogram done if necessary, and also have an MRI done if necessary. Women under 40 tend to have what they call dense breast. It has nothing to do with the overall appearance on the outside. However, I feel like imaging under the age of 40 is necessary anyway, because I feel like women need to have like somewhat of a baseline before they turn 40, because there are so many women who turn 40 that go in for their first mammogram and they're diagnosed then. And so again, push. If you are noticing something different, go ahead and push for the testing. It's not going to hurt anything to have it done. At the very least, you'll have at least a baseline of, what's normal for you. And at the worst, you will get answers sooner than later. So we have the discharge, the sudden change in your overall breast, and then the sudden change in your nipple. And this definitely is going to go into what I'm going to say next, because this is one of the main signs that I know most people know of when they think about breast cancer. But unfortunately, most people, when they discover it, it's like big, it's a huge size. And so you're wondering, why didn't you catch it earlier? And so that next one is going to be a lump. If you are doing your self-breast exams regularly, you will be able to detect a change in your breast tissue much sooner. And I highly encourage, I know, some recommendations are no longer pushing that you do it every month. I highly recommend that you do it as often as possible. I don't care if it's twice a month, 3 times a month. At minimum, you need to be doing it once a month. You need to be able to detect if something is different in your breast tissue as early as possible. If you are able to discover a lump as early as possible, you're giving yourself the best chance of survival. You're giving yourself the best chance to get early treatment. You're giving yourself the best chance to beat it, okay? And so you want to be able to discover that lump before it's protruding out of your skin. You want to be able to discover that lump before it's 5, 6, 7, 8 centimeters. Doesn't seem like that's big, but y'all, you can find it. I promise you. Know your breast, okay? And so if you are feeling around and you discover something that does not feel like it's been there before, you need to call your doctor, okay? You want to have them examine it. You want to see if they can feel it as well. If they do or if they don't, doesn't matter. All you know is you feel it. And so that's enough. That's enough for you to go ahead and get an ultrasound done. It's enough for you to have a mammogram done. It's enough for you to have an MRI done. If you feel something that you know that is abnormal, don't wait. Don't assume that it's benign, because for a lot of women under the age of 40, it is not benign. A lot of women are going in thinking that it's nothing to worry about, and they're coming out learning that they have breast cancer. So take it serious. Do not ignore that sign. Don't wait until it gets bigger. If it's small, you go in right when you feel it, okay? And like I said, it's a good thing if you discover it's small, all right? One of the ways in all of the things that I told you so far, and all of the signs that I want you to be able to identify and recognize and not ignore, the biggest thing that I'm going to say with these signs is being able to compare it to the other side. And so if you feel something on one side and you don't feel it on the other side, that is a reason to go call your doctor. You don't really need a lot of reasons to call your doctor, but if you're looking for valid reasons, these are valid reasons, okay? And so if you discover something on one side and it's not on the other side, always do that comparison thing, because sometimes, most times, it'll help kind of ease your mind from worry if you feel it on the same, or if you feel it on the other breast on the same area, in the same area. And so if you feel something in one area, you go to the other breast, the mirror image of it, and you feel it in the same area in that breast, then more than likely that's your normal anatomy. Okay, that's normal for you. If you discover something on one side and you don't discover it on the other side, again, these are all red flags. And so don't ignore the red flags. Go get seen. So just to share a little bit about my story, if you're watching, if you came across me for the very first time and you don't know all the backstory, I was diagnosed at the age of 37. I was diagnosed because I found something in my breast that I knew was not normal. In terms of the timeline of when I decided to see a doctor, it was only about 2 weeks. It took me about 2 weeks to see if that would go away, because at that time I was actually lactating. And so that was a whole another layer that I'll have to get into in terms of trying to figure out when to worry, not to worry if you're lactating. But again, I was lactating at the time. And so for me to discover something while lactating was not abnormal. What was abnormal was the fact that what I discovered, it remained there for at least 2 weeks and it didn't change. And so at that point, I knew it wasn't a clogged milk duct. I knew it wasn't mastitis. And so everything that was associated with breastfeeding that it could have been, I determined that it probably wasn't that, and that I needed to be seen. And so fortunately, I was able to get in as early as possible. And the timeline from which I felt what I felt to where I started treatment was really fast. And so that's why I'm telling you this. If you discover something that's different, if you find something abnormal, you need to get in as soon as possible. Early detection saves lives. We're never going to stop saying that because it matters. Early detection saves lives. So don't play around. Don't wait. I remember learning a story of a young lady that waited like a year because she was afraid. Don't do that to yourselves. As soon as you discover that something is wrong, you get in there and you get seen, and you fight, you push to get seen. Okay. All right. So that's all I have for today. Just to recap, signs that you don't want to ignore. You don't want to ignore discharge. You don't want to ignore nipple changes. You don't want to ignore breast changes. And you definitely don't want to ignore a lump. These are all signs and reasons for you to call your healthcare provider and be seen and have additional testing done. Make sure you are able to have the additional testing done. Make sure you are able to confidently rule out that there's nothing else going on, so that you can ease your mind from whatever it is that you may be experiencing. Thank you so much for watching. Guys, I'm going to ask, please like, comment, subscribe if you want to continue to be able to see material like this, if you want to be able to receive content like this. Subscribe, share this information. Don't keep it all to yourselves, because you may be able to save someone else's life. All right. Thank you so much, and I'll see you next time.